What's up, guys? Just wanted to do a video on a topic that is kind of driving me crazy because, well, I'm still involved in, not involved. I just keep forgetting to leave the group, but the benzodiazepine support groups. Ah, man, it's a very touchy topic because people are very sensitive about this. They will bash you if you're not suffering what they're suffering. If you don't have this, then you're lying. If you haven't been on this, then you're lying. Da, 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 da. It's like the frickin' it doesn't end. So benzos obviously work on your GABA receptors. You know, there's no dopaminergic properties. You're not messing with your dopamine. You're messing with your GABA receptors. Your stay calm, your sleep, your this or that. So yeah, of course it's a touchy subject. But the thing is that what people I've came off multiple benzodiazepines. I'm not gonna lie, like clonazepam, lorazepam, alprazolam. You know what I mean? It's months at a time taking them every night. You know what I mean? A couple times trying to get through opiate withdrawal, which I was taking like 6-7 milligrams in a day just to get off. Sleep through the withdrawal. No, I still didn't sleep through the opiate withdrawal because, well, dopamine, that's what your brain wants. It's not GABA related. You know what I mean? Except, I mean, it's not just. It does calm you down. Opiates calm you down. So they, in a sense, do work on GABA receptors, but it's mostly dopamine related. That's why they call it dope. But the benzo holocaust we're in. I mean, it drives me crazy to see how many people. It's not that it drives me crazy to see how many people are suffering. That's not what drives me crazy. What drives me crazy is that there are people that will straight up say, I didn't have symptoms, or I did, and I got through them, and I'm okay now. You know what I mean? I didn't have post-acute symptoms, and Penny, all right, baby? And I didn't have, you know what I mean, this and that. And people attack them, like they're coming at them like, there's no way you were on, I didn't experience that, so there's no way you, dude, just shut the fuck up for a second. I'm not downing anybody's withdrawal. In fact, my mother was on 1 milligram of Xanax, alprazolam, for like 32 years. She stopped cold turkey, okay? Stopped. Never took one since. It's been almost 2 years now since she took her last dose, dude. You know what I mean? And I asked her, I said, are you having any withdrawal symptoms? What is withdrawal? She asked me. That's what she asked me. I've never been told about it. I don't know what it is. What is that? Never mind, Mom. No. It's fine. It's fine. You're fine. Nothing. She took it for sleep, which there is a noticeable difference between people that take it for sleep and people that take it throughout the day for anxiety. When you're taking it throughout the day, your brain associates the effect with anti anxiety. It knows what the pill does. So it associates the pill with calming down. Now at night, when you go to bed and you take any type of benzodiazepine, it's going to relax you, yes. But most people fall asleep before the effects actually kick in, and a lot of people don't realize that. They already fall asleep just knowing in their head, yeah, I know this is going to happen, but they take it, they fall asleep, and that's it. You know what I mean? They're done. Now that's why those people tend to not have as much as the difficult issue getting off of them. Now here's another thing I want to mention, right? if you if you're like me and a lot of other people out there that might be watching, when you take when you've been through withdrawal, like let's say from opiates, right? People are going to tell you straight up, benzo withdrawal is worse and this and that. Yeah. If you're taking like 20 plus milligrams of alprazolam a day for however many years and you stop, yeah, I could see that. But here's the difference. I've noticed something, a little kink in the matrix. When I was in rehabs in my life, and I was with people that were coming off of Xanax, alprazolam, or even Klonopin, or both, abusing both, because they knew Klonopin lasted 8 to 12 hours and Xanax was a quick boom knock off, you're done. I was in rehab with a lot of people like that. Those people that got clean, I don't know, well, I do know, and quite frankly, I don't give a fuck what people think. Excuse my language for the women out there. I don't give a fuck what people think. Those people that were abusing those medications, once they get through the detox phase, and a lot of them have been through opiate withdrawal before. That's another thing you got to keep in your mind right now. They've been through opiate withdrawal before, which opiate withdrawal, I'm sorry, but it is downplayed to the max, dude. People are going to tell you, oh, it's not, benzo withdrawal is way worse. Dude, if you've been through opiate withdrawal, your dopamine receptors, the pleasure center of your brain, the chemical that releases the feeling of, oh my God, I never want to not feel this way, is stopped, along with a major panic attack that lasts for, God, I can't even tell you how freaking long, that they have to get on MAT for it. Sometimes for life, some people, okay? People have had seizures in opiate withdrawal. So don't downplay opiate withdrawal as if, oh no, it's not as bad. There's people that have seizures. There are people, I've seen it in rehabs and detoxes. People have had seizures coming off of opiates. And I asked them, what did you piss for? Just opiates, fentanyl. No benzos, just fentanyl. Well, hello. So my point is that don't downplay opiate withdrawal. It sucks. Anybody now I'm grateful to have been clean for, I don't know how long now. I lost count. I stopped counting because the more I think about it, the more I keep it, it's not worth it. I don't remember what it feels like to be high off an opiate anymore. I don't remember. My brain, thanks to my ADHD, I don't remember what it feels like, so I would rather not even touch that stuff ever again. But I'm telling you right now, benzo withdrawal, the biggest demon in benzo withdrawal is joining groups for support. And on top of that, not acknowledging your pre-existing conditions. And what I mean by pre-existing conditions is, excuse me, sorry, I just ate. You know what I mean? Like thyroid. Me, you all know me. Anybody that follows me know I have hyperthyroidism. But guess what? Right now, I'm the healthiest I've been probably ever. Got my blood work done. I get my blood work done monthly. I even piss for the doctors monthly, not being on anything. I still piss for them for a disciplinary reason. Just so I can show that I'm not taking any substances. THC, maybe once a week. If it, maybe twice, if that, but I don't have a tolerance for THC. So I go there, I do what I have to do to keep myself in place. Just, it feels good to know that. You know what I mean? But at the same time, benzo withdrawal is very complex. And I'm not going to lie, this is going to hurt some of you. There are certain people that are going to have extreme symptoms. And because of that, this is how I know. The evidence for that is that there are certain people, for instance, alcoholics. I know certain people that have been drinking for over 18 plus years, 20 years straight, never missed a day, that stopped suddenly and had. I'm not saying to anybody do this because don't. I'm just saying I know certain people that have suddenly pretty much stopped their alcohol consumption. Not cut down, not tapered. They not switched to a benzo. They stopped their alcohol consumption and had no withdrawal, nothing at all. My own mother, not an alcoholic, 32 years, 1 milligram of alprazolam every night. Maybe she missed a couple nights, whatever. She stopped one night, nothing. I said, Ma, um, did you have any withdrawal symptoms? What's that? Uh, Never mind. Just go about your day, Mom. Love you. Mwah. That's it. She was never told, so she doesn't obsess over it, so she doesn't freak out over it, so therefore she never had issues. Now that might be genetic, that might be some sort of an enzymic disissue. Not an issue. It's it's hard to tell. I mean, it's still a medical mystery as to why some people, the same people that don't have withdrawal symptoms from alcohol, tend to not have withdrawal symptoms from benzos. I mean, GABA's A and B. I call it GABA's alcohol and GABA's benzo. The receptors in your brain. You know what I mean? It's about the kind. I've had panic disorder since I was 8.5 years old. I threw up before getting on roller coasters. I threw up on Christmas Day. I threw up on my birthday. Any ounce of excitement, I would vomit and panic, and it wouldn't stop. It went on for hours and hours and hours. All freaking, even through my Muay Thai, through my Russian Sistema, through all of my fights and practices, training, I still had panic problems. There's times I had to cut class early because I was panicking. The only thing is I wasn't abusing benzos. So yeah, like I said, there was times where I was taking high dosages to get through opiate withdrawal or to deal with just general stress of being on opiates. You know what I mean? 2 milligrams of Clonopin, 3 milligrams a day for months, or alprazolam, forget it. That's the only benzo I had any withdrawal symptoms from in terms of physical crazy withdrawal was alprazolam. Yes, it happened to me. Oh, it did. Oh, yeah. I tell you, it did. I mean, I remember trying to get through opiate withdrawal. I took 5 to 6 milligrams of Xanax a day. The footballs, the blue ones, prescribed, not to me, to somebody else, but I was taking them. And when I tell you, it took 2 days. I stopped. I was like, I'm done. All right. 2 days later, I'm at work. Boom! My body is on fire. And I was like, oh, like I was freaking out. I didn't know what to do with myself. I said, what is this? The reason I said, what is this, is because, like I said, it wasn't dopaminergic. It was not dopamine related. I didn't crave Xanax. I wasn't. I'm not a drinker, so you know what I mean. It's not something that I crave. I just wanted to sleep through my damn opiate withdrawal. Did I? Not a second. Not a freaking second did I sleep. No matter how much Xanax I took, nothing. So went to the hospital that day. I took too many beta blockers, thinking it would stop the whatever was going on. And guess what? I ended up in the hospital, and I was there admitted for elevated heart enzymes, which medically makes sense during withdrawal. They admitted me overnight, and guess what? All I got was melatonin. I didn't get Librium to counteract the effects and make the withdrawal a little easy. No, 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 no. They let me go the next day around 1:37 p.m. the next day. They let me go. They discharged me. So what did I do? I hit up the person I get Xanax from. I messaged her and I said, hey, give me all of them you got. She was like, but you only usually buy 4 or 5 at night. You don't seem to be taking them like that. No, I don't want to talk about it until I see you. I'll tell you what happened when I see you. And she's a good, decent person. When she was looking at me, she's like, oh, "Are you all right?" She even threw me a few extra for free. She was like, "Well, I want you to get better." So she had bars, and I got the bars, and I tapered off. And within 1.5 weeks, it was done. You know what I mean? I tapered from the 5 or 6 milligrams I was taking. I only took zero point 0.5, a point 0.5. If the withdrawals got bad, I took a point 0.5 with a beta blocker in between doses to go further without dosing. And I remember, for 5 days or so, whatever, it was a little rough. I started to get sleep more and more. But that little point 0.5 wasn't really doing much. It took the edge off, and I wasn't as depressed and as anxious. But at the same time, I still felt the symptoms, the benzo belly. I felt all that stuff. I'm not kidding you guys. I felt it all. Oh no, it does. It happens. It's not fake. So I did what I had to do. I tapered off. Once I felt that zero point 0.5 knocked me out for like 2 days. I was like, I woke up and I'm like, yes, the zero point 0.5 worked. It means my tolerance is officially down here from where it was. Once that happened, to 0.25 within not even 2.5 days. And I stopped cold turkey after that. No post acute, nothing at all. Absolutely nothing. And I was so happy about it, but it scared the living shit out of me. I was like, there's no way I'm ever going to take that much Xanax ever again in my life every day for this amount of time. No, it ain't gonna happen. It's not gonna happen. So my point is a lot of people out there, you're in these groups on Facebook, you're in the benzo buddies, you're into this and that, and everybody's going to be talking about their struggles with it and coming off of them. And you have to understand it's a domino effect. A lot of these people are reading one story after another, after another, after another, after another. Look up House MD, the show Dr. House. Yes, House. Look up the show Airborne. One person was sick. He had Mr. Pang had vomiting, rash, different all types of symptoms, right? Once House started to talk about it over the megaphone when they asked if a doctor was on board, telling everybody, and guess what? They all started having the same rash, vomiting, fever, all types of issues. And at the end of the episode, House admits, and he finds out, through scientific, he finds out that it's not airborne. And he announces it over the megaphone, and everybody just goes, and he says, "Don't worry, guys, it's all right. You're suffering mass hysteria. This is what happened. You guys are all okay." Everything stopped. Everybody was fine. That is true. That does happen, and it is a real diagnosis. Mass hysteria. Yes, it does affect people. It does happen. So benzos it's a really tough subject because GABA receptors are basically your life, dude. Freaking out, panicking, anxiety. We all have anxiety. Anxiety is the same emotion that drives excitement and happiness, as well as sadness and panic. It's the same exact reaction. It's the same emotion, just channeled differently towards perspective. You get what I'm saying? So I'm not downplaying anybody's symptoms. I believe there is a genetic component or an enzymic component that does have to do with how people react. Like I said, with alcoholics that don't have withdrawal symptoms, and I'm like, what? You've been drinking that much for how long and nothing? I mean, some people are like that, dude. There's, I don't know. It's still a medical mystery. You know what I mean? Ask any physician, diagnostician, ask them all. Ask any psychiatrist, psychologist. They're gonna be like, we have ideas and theories, but we don't know for sure. That alone should calm me down a little bit. So just know that the way I tapered off of any benzo that I was on, I've taken clonazepam, lorazepam, and alprazolam for extended periods before. Extended, I mean, over 6 months, close to a year, over a year. I've taken them every day at semi-high dosages slash high dosages. It depended. You know what I mean? I've done it. Trust me, I've done it. Clonazepam, for some reason, never had withdrawal symptoms from it. Stopped cold turkey, never had issues. Alprazolam, issues. Lorazepam, no issues. Nothing. Stopped and nothing. Even though I still tapered just for shits and giggles, to be safe, I didn't have any withdrawal symptoms. I don't know why. I'm not saying that you're not having them. I'm not saying that you're not. I'm not downplaying anybody's stories at all. But my advice is don't bash and attack people that say they don't have issues with it, that stopped and had no issues, or they had some slight issues and they got over it and they're fine. Because, like I said, a lot of people I went to rehab with that abused benzos and took them to get high at dosages you couldn't even imagine got through a freaking week and a half, maybe 2 weeks maximum of withdrawal physicals. And they just, afterwards, I was fine. I could sleep just fine. Because, like I said, there's no dopamine related properties to it. You don't sit there and fiend for it. You don't do it like that with coke or, cocaine with not physical symptoms, but opiates, forget it. My opiate people out there, nod your head, because you know damn well opiate withdrawal is like a combination of both. Like Cat Williams said, it's a panic attack, it's a insomnia, it's sweating, shitting yourself, pissing yourself. If you got those symptoms, sometimes people don't. But I'm telling you right now, opiate withdrawal ain't nothing to downplay. Because now here's what I wanted to say. A lot of these people that are going through benzo withdrawal, and a lot of them are patients. They're not, abusers and addicts. Those aren't those people. The people that are going through benzo withdrawal, a lot of them are patients that have been prescribed for however many years or decades, or you know what I mean. So when they feel withdrawal, I mean they can't even, they type and write these stories that are actually very impressively written. Like, you guys could be great writers. I'm not gonna lie, you can be great writers, because it is like the worst thing in the world. If you talk to anybody that's been through opiate withdrawal and has abused benzos to try to get through opiate withdrawal, or did both, got clean, these people tend to come out the other side and they're all right. You know what I mean? There's a reason for that, or a couple reasons. The people that are patients, they've never had withdrawal in their life, so they don't know. Now, suddenly, all of a sudden, it's like, I got to get off benzos now. I can't do this anymore because this person and this person said it. I need to get off them right now. I can't get on them ever again. I'm scared that my GABA receptors are going to be permanently damaged, and this and that. And then there's people that say, I've been off for 6 or 7 years and I'm still having withdrawal. You're not having withdrawal symptoms, dude. You are not having your GABA. If your GABA receptors were that damaged, you would not be able to emotionally respond to anything, which you are doing to an extreme extent, because you are still obsessing over the thought. You're still obsessing over all that stuff. You don't have to obsess. If you're that far off, now I'm going to give you guys a couple tips. This has worked for certain people I know that have gone through that, all right? Now, I'm not a doctor, but through personal experience and experience of passing that knowledge on to others that have done it, I have a buddy who was on, actually, no, he was on clonazepam and lorazepam, yes, for 19 years, right? He tapered down, hard tapered, went through withdrawal, crazy, Tammy was crazy withdrawal, which I'm not downplaying. And then I think it was like 8 months goes by. I'm still suffering from post-acutes. I told him, I'm thinking of pharmacokinetics and how they work. And I'm like, take a minimal dose. Take the smallest dose you can. You don't have a freaking tolerance anymore, because if you take a small dosage and it freaking calms you down to the point where it knocks you out, a lot of it is up here. And that's fine, because GABA, I mean, a lot of it, you can't predict GABA receptor. You can't predict whether it's real or not. I told him take 0.25 of what you were taking. He did. He was on 2 different meds. I told him to take a zero point 0.5 of one of his medications. He did. And guess what? A year goes by. I hit him up. Are you all right? Dude, I don't know what it is about what you said, but I haven't had any issues. I feel great. Since I took that little dose so long after I stopped, nothing came back. And in my head, I'm thinking, if people are willing to taper for 6 or 7 years or more, and you're not willing to do this one little thing, then you're crazy and you're fucked up in the head. If you're having post-acute symptoms over a year later that you've been off of it, take a tiny, the smallest dose you could possibly take of that benzo, because it's still a part of the tapering process, at least in your brain. That's why I said I don't downplay people's suffering. That could actually fix the tapering process. You put yourself through all this hell, all these post-acute symptoms. You take that tiny little dose, your brain fixes. It goes back to normal. This is what I've noticed through multiple people. The 2 I'm mentioning, another one was a girl. She was on alprazolam since she was 15. She's now 39. When she was 37, she got off, right? Same story. Having post-acute symptoms and this was like a year and a half, a year and 2 months, sorry, after. I told her the same thing. I said, just take 0.25. She did. Suddenly, no more post-acute symptoms. A year after that, no more post-acute symptoms to this day. She hasn't had to take anything. She doesn't even take melatonin, dude. She goes to bed without anything. Okay? I go through trial and error. I don't go by my emotion. I go through trial and error. I think like a scientist. That's just how I am. But then I have people emailing me the same thing. I did what you told me, and this is what happened. You were right. I don't have any symptoms anymore. It's a part of the tapering process. If you are willing to sit there and taper for 6 or 7 years down to a 0.275, some ridiculous amount, you're breaking the pill in little pieces and swallowing it. You're not even getting that dose, dude. Your cheeks, your tongue, your lips, your saliva is absorbing it all before it can even get to your stomach, dude. It's in your head at that point. I'm sorry to say it. You can do the water taper and your milk taper, all the crap you want. You can do all that. But you keep obsessing over these people's stories and what they say they went through. This one chick, straight up, I'm not lying to you, in the benzo group on Facebook, she straight up said her left pinky toe went cold and numb. And that was because of benzo withdrawal. Guess what? Next day, I check out that page, somebody else posts and says, I read a post 2 nights ago about somebody that her left pinky toe went numb and cold. I woke up today, my pinky toe is a... Dude, no. If you are telling the truth, you have poor circulation, and there's different reasons for that. If not, you're lying, you're making it up, you're freaking the fuck out. I'm telling you, there was one time I thought I had post-acute symptoms. I went and got my thyroid checked. As you all know, I have hyperthyroidism. Once that thyroid got back to normal, all those post-acute symptoms went away. Because that's what was causing my panic attacks and my high blood pressure. Now, I'm in a perfect bill of health now, and I'm so grateful for it, because diet change, exercise, all this stuff, everything has been benefiting me. Yes, I do take thyroid medication. You know what I mean? I have old medication bottles that I don't, wherever the fuck right there, that I don't even touch. You know what I mean? They just sit there. I don't even know why they're there still, but they just sit there. don't read into the horror stories and don't feed into them. There's a page called The Lovely Grind on YouTube. Follow him. He talks a lot about the positive because a lot of people, when they actually get through it or don't have withdrawal symptoms, and one of those rare people that don't have any withdrawal symptoms, or they get through their taper and they're done, they don't come back. They don't come back to these YouTube videos and channels. They don't come back to these Facebook groups because guess what? What they think they sit there and they're like, oh man, I was going through all that. Now I'm all right. I was freaking out. I'm not gonna go feed back into that. Whoa, whoa, whoa. And they're looking from a third person's perspective, and they're like, I'm not going back into that because if I do, it's gonna remind me and give me PTSD from. You don't want that, guys. My little taper method that always worked for me. I'll end this video with this. My taper method that worked because I've been through opiate withdrawal, and like I said, a lot of patients that are prescribed, they've never been through a withdrawal, so once they feel it and it's like a freaking explosion in their soul, so they're going to exaggerate. I'm not saying downplaying what you're feeling, but they will exaggerate and make the stories seem so crazy that they've never been through withdrawal. I've been through opiate withdrawal, benzo withdrawal, gabapentin withdrawal. I've been through Zoloft crash. I've been through all of them at once in a rehab that took me off of it. You know what I mean? I will straight up tell you the only taper method that ever worked for me was waiting until I had pain or too much pain or whatever the amount of pain was that was the maximum. Waited until I couldn't tolerate it anymore. And I would take, let's say you're taking 3 milligrams of alprazolam, I took 0.5 to take the edge off. And I knew it wasn't going to put me to sleep. I knew it wasn't going to take all the pain away, but it took somewhat of the edge off in a sense. Most of it was mental. When that 0.5 started working again, I knew I was in the clear. I said, screw it. You know what I mean? It worked. Now I can get down to 0.25 and just stop. Klonopin, I don't know why I never had issues. All I know is when I take Klonopin, I feel depressed. When I don't take it, I don't feel depressed. That's the only thing I know about Klonopin, but I had taken it for extended periods of time and stopped, and I didn't have crazy withdrawal symptoms. I just had mental betterness. You know what I mean? Alprazolam, different story. I was taking really high dosages, so you know what I mean. It's not that I'm downplaying what you people are thinking. I'm not saying that at all. So I've gone through it. So, and I know people that have and did what I told them to do, and they're okay now. They never went back since. It's a part of the tapering process. If you wait 8 months, a year, and you haven't taken any benzos, and you're sitting there complaining about post-acute symptoms, you might think it's freaking crazy or a bad. Oh, I don't want to go back. I don't want to touch it ever again, dude. If you take a 0.25 and it knocks you the hell out off your fucking ass, and you feel calm, that lets your subconscious, your brain, and your mind all know, and your subconscious behind in the back part of the brain, obviously. But your mind and your brain are separate entities. It lets both of them know that your tolerance is down, it's low, your receptors are not permanently damaged, and for some reason after that, it's like the tapering process is finished. Some people do it twice. They take a 0.25 twice within the span of a week or 2 weeks. They don't have any issues. They don't get addicted to the stuff again or nothing, but they don't have any issues. And they're like, wow. So I just wanted to put this video out there because I hate seeing people attack other people with good stories and say, screw you. You don't know what you're talking about. You're a liar because I went through this. You know what I say to you? Fuck off. Because if you're going to downplay people's success, then suffer. But if you want to be a real human that has decency, you respect other people's positive stories and stop neglecting, well, stop feeding into the negative stories. Stop. Just stop because you're going to drive yourself fucking insane. You're going to go crazy. Your brain has mirror neurons. It can do whatever it wants whenever it wants. If it reads something, it can mimic any type of CNS issue just by reading it. So just know that, and I'm not downplaying anybody's symptoms. I know people have sensitive withdrawal to it. That is true. But to find out or not is to not feed into the horror and to please Go by your story and not anybody else's. Love you all. I'll come up with a new video soon.